Hey all, this is Pete Croft, one of your ultrasound fellows. In case you're wondering what ARDS looked like on ultrasound, I wanted to present you with a short case. I was in the acute area a few weeks ago when a 57-year-old came in with myalgias, sweats, chills, etc., looking very ill to the acute bay 4. He had been seen 3 days ago and had a chest x-ray, which is right here, which was read as negative. He had had similar symptoms, but had normal vital signs, slight fever, defervesced in the ED, and was sent home. Otherwise healthy gentleman. Came back to the ED with SATs in the 70s, quite tachypnic, and a fever upwards to 104, 105. Lung sounds were terrible. So he came to the ED. I was actually scanning with some of the residents and saw that he had been triaged. The attending doctor told me to take a peek at his portable chest x-ray, but I wanted to do the ultrasound first and then correlate it with the chest x-ray findings. I find that with numerous things such as DVTs or gallbladders, it's nice to do the ultrasound first and then confirm your findings or see what the findings are on other testing modalities. So here's zone 1 in this gentleman. He was not intubated at this point. I'll tell you what happened to him shortly hereafter. But this is zone 1. If you don't remember where zone 1 is, here's a quick little schematic. As you can see here, zone 1 is in the right upper chest, anterior wall, and 2 through 8 thereafter. So 1 through 4 is the right side of the chest, 5 through 8 is the left. This serves as a model to perform a comprehensive lung ultrasound. You can also look at posterior fields. We didn't in this case. It's especially helpful with children. So back to zone 1. As you can see here, zoomed in, is the pleural line and the rib shadows on the left and the right. Rib shadows. Here's your pleural line. This is not normal. This is, some call it the shred sign. It looks like almost like a shredded piece of paper. Again, the lung, you shouldn't see anything. You shouldn't see any type of consolidation or B lines. These lines emanating from these little consolidations are deemed B lines. With pneumonia, you'll often see them unilaterally. As you'll see in this case, they present in a diffuse pattern, such as you'll see with flash pulmonary edema. The difference here is, as you'll note in all these slides, is these small little subpleural consolidations. So these little areas below the pleural line, which is here, that appear almost like tisular substance, such as like the liver. This is abnormal. This should catch your eye whenever you do a lung ultrasound. You should have a nice smooth pleural line. This is jagged and looks like a shredded piece of paper. So this is zone 1. Here's zone 2. Likewise, here's B lines on the left side of the screen. Here, you'll see these subpleural consolidations, again, kind of hiding behind the rib here on the left, but you'll see jump into view right here. And again, B lines here. B lines all the way down to the end of the screen. Abnormal lung. So this is zone 2. Here's zone 3. This is nice representation. See how this looks like the liver has little small internal echoes, and these B lines emanating from the posterior aspect of this subpleural consolidation. Zone 3. Here's zone 4, so you know this because here's the liver. The gain could be up a little bit, but here's the liver here, and then just above the liver is lung. And you'll see here, you shouldn't see that point of the lung. This should be aerated and invisible with ultrasound. So if you're seeing anything here, that's abnormal. Here's a better view here of zone 4, and if you train your eye to look down here at the bottom, this is a nice spot to catch small pleural effusions. This patient has a small pleural effusion here on the right. You can see the lung kind of floating in the pleural effusion, and it is consolidated. Zone 5, so now we're onto the left side of the chest. Again, subpleural consolidations. This is another field, so this is the 5th field with lung findings. Zoomed in, I usually start out and zoom in, or I start in and zoom out. That way it gives you a nice view of the entire lung surface. Here's zone 6, often tricky to get. Here's the heart right there, but as you can see here, B lines as well in this area. I don't see as much subpleural consolidation, but I do see B lines scattered here between these two rib shadows, and here's on the right is the heart. And you can get a vibe here that there's no big pericardial effusion. I would get some more views, but there's certainly not a huge hemodynamically significant pericardial effusion from this view. Here's zone 7, so we're up under the left armpit. Again, small subpleural consolidations with B lines emanating from the bottom of these. Another positive lung field. And lastly, zone 8, this is a really nice view. In each one of these rib spaces, there are subpleural consolidations. And you know this, the spleen's right here, your diaphragm's right here. I don't see an effusion here, but I'd be shocked if there wasn't if we did a more comprehensive posterior lung exam. This is his chest x-ray in the ED, which I peeked at after I did the ultrasound. Bilateral diffuse infiltrates in an otherwise healthy gentleman with all the signs and symptoms of viral syndrome. He tested positive for H1N1. He was sent up to the ICU after being intubated shortly after our ultrasound. He's still in the ICU, has a trach and a PEG tube in place. If you have any questions regarding this, shoot me an email. I think the take-home points are these diffuse B lines, which should give you a differential of flash pulmonary edema, as well as ARDS. But the difference here is the clinical picture as well as the multiple, and we saw this, the subpleural consolidation with emanating B lines and small little bronchograms in the middle of the texturized lung tissue. So send me an email if you have any questions, and thank you.